Hello, changemakers, and welcome to this episode of the HIMSS Accelerate Health podcast. This is Kerry Amato, Executive Director of Health Innovation at HIMSS, and today I'm joined by Brook McCall, Director of the Tech Access Initiative at the United Spinal Association. And for those of you that are not familiar with the United Spinal Association, it is an organization that is dedicated to enhancing the quality of life for all people living with spinal cord injuries and disorders, including veterans. They also provide support and information to loved ones, care providers, and professionals. And I'm super excited about this conversation for a couple of reasons today. One, I think it's just an important area that as people who work with tech providers and tech developers that we really need to be talking about. But in addition, this is kicking off a series that we're doing this year. For the first time, we're going to be interviewing 10 different patients over the next 10 months and really working to amplify and elevate their stories as it relates to both the development and the use of technology. So Brooke, you're our first guest and the first kind of stop. So we are thrilled and welcome to the podcast today.
Thank you, Kerry. I'm excited to be here.
Awesome. Well, I thought we would just start with a quick introduction of your background and kind of a little bit of the work that you're doing with the United Spinal Association. And I'd also like to touch a little, I think, on what the pandemic has been like for your community. So maybe we just start with you. Who are you, Brooke?
Sure. Yeah. I'm happy to introduce myself. Yes, I am Brook McCall. I'm very excited to be part of this tech space, but really it all has stemmed initially from myself and my patient experience, and then my life living as a quadriplegic. So in 2002, I locked myself out of my house. I decided that I could. Well, actually, it was suggested from a neighbor that I try to climb over from his balcony to my own, and at the time it sounded like a great idea. And unfortunately, I fell backwards and broke my neck. So I've been living as a high-level quadriplegic, a C4 level. So I do not have any use of my arms or legs for 18 years. Getting close to 19 actually at this point. And so I've learned quite a bit. Of course, tech has changed a lot in that time frame, as well as my interaction with tech and my even awareness, which is something that I'm working really hard in my role as the Tech Access Initiative Director, is to really close that gap. There's a lot of lack of information flow of the available technologies that are either built specifically for our community or things that just really work well. They stemmed from some other need, but of course there's a co access that grants us amazing independence, and there's just tons of potential there. So our program is something that it's been really exciting. We launched it actually in last year, so it's only a year old, but we've been really busy making sure just to try to close that digital divide a lot of our community members fall into, as well as just increasing awareness, and then of course fostering those relationships upward with the tech industry folks wanting to get our voices heard. The mobility disability community has been largely less represented in a lot of these conversations, so we are really trying to plunge ourselves in there and get our members heard as experts, because we are, and with tons of really exciting knowledge on their sides as well, just in their own professional backgrounds and experiences.
Well, and what an amazing representative you are to have in that role, in this exciting role. And so I can't believe you guys have only been working on this for a year, but it sounds like no better representative than yourself. So how has it been for yourself, the community during the pandemic? We hear all the buzzwords, telehealth, remote patient monitoring, all those things that, healthcare has been working on for years, but maybe we weren't quite there. What was the experience like? Were there wins? Were there losses?
Yeah, I find myself these days, talking about a lot of silver linings, but of course, that's the optimism, and that's these wonderful conversations I've been able to take part in. But the reality is that, it's been really difficult. So as a quadriplegic or just people in wheelchairs in general often who I'm addressing, but folks of all kinds of mobility disability needs. It's been difficult. There's been a big problems when it comes to accessing care. Of course, there has been the positive of telehealth, and that has been revolutionary for quite a few of us. But of course, there's some people who don't even have things like access to broadband or proper smartphones, or the ability to access even their computer. They just haven't been trained in terms of maybe accessibility. Excuse me, accessive technology they may need. And so there's still a gap, but for a lot of us, it just means staying we're at home more. I'm not a homebody, but the reality for a lot of our community is spending a lot more time at home. There's a lot of barriers that keep people from um, the kind of community interaction that they deserve. And so this isn't exactly new. Many people will say, "Oh, I'm already used to being somewhat isolated," which is, unfortunate. I think there's a lot of work that we need to do to make sure people are included and have these the full lives they want and will increase their health by having access to. So more time at home, less access to care. A lot of people's care structures, if they rely on outside help in the home, have been kind of flipped where their family members or you know less people in their home they've had to make do, and we're less connected. For us, we're a chapter network. We have members across the country, and we're usually getting together and having events, and that's we've had to shift completely to virtual, which has had some really great positives, but at the same time, some people are being left out. They're not having that access to their peers and the support network that they rely on.
Yeah, for sure. Are there types of technologies, I guess just educate me as well as the listener here that, types of health technologies that your community really relies upon a lot or could use more of?
Yeah, yeah. So when it comes to, I mean, I'm a big proponent of voice. I
Mm,
have kind of seen voice through. That's what they presented to me, back in 2002 in the very not much of a tech center. It was kind of like an OT closet that had a computer in it, and they said, "Here you go. Check your email on Dragon Naturally Speaking." And I did. It took me like an hour the first time, and it was upsetting because I had, I was a college student before my injury, and I said, "Oh, my new reality will be so different." But voice is really, voice is something we're all using now, which has been such a boon on our end, and especially, potential of AI. It's doing a great job in actually being able to hear us and easily transcribe. That's been fabulous. We rely so voice control for folks like me who are up higher level quadriplegics. There's a lot of switch control people can use, just
mm,
buttons to push things. Environmental controls and smart speakers have really elevated in our lives as these unique touch points. Independence granting tech. And our phones, like having access to our phones has been huge. And now there's quite a few built-in accessibility features. So some of that's voice tech, like Apple has a voice control feature. There's a voice access for Android phones, as well as just assistive touch features for people who have limited upper limb mobility. So maybe they can just use one hand, but it would be really hard for them to do maybe like a pinch or
mm.
like a dragging motion. So yeah, there's exciting things there, and it opens up a world for us to connect via our phones, tablets, computers, and that's huge. We have this amazing community online, and we get to share, our kind of tips and whatnot.
Yeah, it's amazing how technology in that way can make the world feel smaller and more
Uh,
accessible. And I think voice, I'm with you. It's come so far, and I think it'll be fascinating to see where it goes next, and how it helps individuals like yourself and others with spinal cord injuries, that kind of thing. Now, do you guys is VR of interest at all to the community?
Yeah, it is. It's huge. Well, from my perspective, I just see this the enormous potential, and kind of having the meanderings, given the conversations we're having, and luckily having access to our Tech Access Council, which is folks in the tech industry, and kind of hearing a bit of what they're working on, and getting involved in some of the initiatives surrounding VR, XR, AR. mixed whatever kind of realities it is. But yeah, the potential there, and as well for healthcare, we have some of our tech access user group that is using VR, and one of them is using an AR technology, and he said it's really been helpful. So even just examining his skin for those of us in wheelchairs, I mean, our skin is a huge issue. With the potential for pressure sores. So finding, there's a lot of smart technologies and connected health features that could potentially really help alleviate that. But for him, he's using his AR glasses so he can have his assistant look at things, and then it can actually show him. Whereas in the past, we've kind of it's embarrassing to say, but my iCloud has many photos of like, what is this? Like, here, let me take a picture and show you. Like, oh, is this mole strange? Is this a
Yeah.
red? Do you want to be concerned about this red spot? And yeah, I mean, it's been really illuminating, and it kind of exciting when we think about telehealth and how we just kind of talked about the ways we can communicate within just our community members, but it's also kind of felt that way in terms of our healthcare providers and having a little bit more access in different ways.
Yeah.
We just did a big talk about telehealth and the areas that are working and the areas that aren't, and it was really illuminating. And one of our tech access group members mentioned the fact that his providers are asking him to take photos of these, if it's a sore or something he's concerned about, please just send that over, which is something in the past that, please come in. We want you to come in.
Hmm.
And then for our community of wheelchair users coming in, and if you have something that's on, the lower half of your body that requires getting you up on a table, which are not always accessible, dressing and undressing, which is, it's much easier to do at home. So actually having that interaction virtually where, oh yeah, you just take a photo of that. And, of course, we want that follow-up if it's needed to have somebody come in. Yeah, that's concerning. I really do want to see you in person. But, having unique technology tools to lessen, especially for folks that don't live close to their medical providers, is really exciting.
Yeah. And so you mentioned I think you said the tech access, I think I want to say it was community or council that you have. And is that you, as I've read that you have a lot of groups on there, like big
Y-
names, right? Facebook, Amazon, Uber, you've got some big companies that
Yeah,
you guys work with.
so I can tell you the most exciting thing that we've built in the last year. So in 2020, during the pandemic, which I think maybe was, kind of again, a little bit positive that we've had more time and energy to just listen, and be part of these conversations that before maybe we're just we're everywhere, we're traveling, and we're busy in this way that you just now have more time to listen. And so yeah, our biggest success was building out bi-monthly conversations that we have between our tech access group, which is our user group, and that's 20 amazing people from our United Spinal community. They have diverse injury levels. They all have different mobility, up from folks in ventilators down to people who are semi-ambulatory, but all who have extensive experience as wheelchair users and people with various levels of paralysis and limitation. And they all come from different backgrounds. So we have folks from the tech industry, a number of engineers, we have medical professionals, and just people who've lived with the technology and are learning and have had to figure out and adapt to making their lives work. And so we're full of stories, and so we have subject specific conversations, and those conversations are, we invite our tech access council. So that's
Hmm.
groups from the industry. They're actually there to listen to our user-driven conversations. And currently that is Amazon, Apple, Facebook, Google, Microsoft, Teladoc, and we've got Uber, Waymo, Zoox, Greenwich Biosciences just joined with us, and I think I got everybody. But yeah, it's growing. It's been a year. There's so much excitement, and we usually get to, depending on the conversation topic, bring in some additional guests, and we really just try to provide a lot of actionable feedback. And then, of course, storytelling, just kind of between the lines. I think the folks learn quite a bit about what our lives look like and, how we're using the technologies. And we learn from each other. It's pretty revolutionary.
I'm sure. And I would imagine that some of the conversations those big companies go back, those well-known companies go back and say, I had no idea, or I didn't know, or who knew, or go on to implement hopefully changes, right? Is the end goal here. Not necessarily changes, but changes or the development. I mean, what are we looking for here? Or both,
Yeah.
I guess.
Yeah, no, exactly. I mean, that's what we want. We want them to take that information and bring it to the proper teams. So, that which is what I, hear the feedback. Yeah, I brought this back, and I know the engineers that are working on this project, or folks that are interested, and they get the big debrief, and I try to make them full of info that are that's easily understood and can be implemented in the ways that ideally, we of course want those changes to happen and feel that impact.
Yeah. And so over here at HIMSS, my hat, I work with a lot of different startup companies that are, have lots of big ideas on health tech ideas and products, et cetera. If they wanted to get involved or to listen or to have some dialogue and understand this community's needs, what's the best way to do that, Brooke? Is that getting
Yeah,
in touch with you? Is
yeah,
that
getting in touch with me.
okay?
I'm sure we'll put my info here.
Yep.
We have a fabulous tech access landing page that I will again also share so folks can take a look. We have all our tech access members up there in little bios, and then we also have some great resources. I mean, something I'd love to just put out there is that our community often doesn't know about some of these exciting technologies that are maybe even built with them in mind. And we need to know those things. So I'd love to have, to get that information. I certainly don't know everything that's happening, and we really want to close that dialogue and make sure people even know that there are such amazing products being developed.
What's striking from this conversation, Brooke, so far is that the needs of the community here that you represent, they're not so different than the needs of the rest of us, right? Like same thing. I was
Mhm.
during COVID, and I have a small child that had a rash. That it was like, do you take them in, or do you take the picture and send it? Which same thing. My doctor was like, can you take the pic? And so I'm struck by just while we're talking about a specialized community, the need that you guys have really transcends that. I'm sure some of the work you do even applies to bigger populations then, right?
Oh yeah, yeah. No, I mean, I like to think if something's, accessible for me, it can be accessible. It helps everyone,
Yeah.
We really want to alleviate the need for, disability. They say like dongles, just extra equipment. I want something to be built with access in mind that will help a number of populations and often be a convenience for, an able-bodied population. There's so many of those tools that are really helpful to everyone. When I show them some of the things I can do, because I figured them out to make them work for me, they say, "Oh, wait a second, I also want to, do that hands-free. That's great." So,
I was gonna say, you're probably your use of voice and things I could probably learn a lot from. I mean, I think there's lessons there. I mean, you probably are a master at it compared to mine, for instance. Yeah. So how do you, I think one of your challenges you touched on earlier then is not only working with, the groups that you work with to inform, the tech development piece, but then making the community aware of what technology works for them and which doesn't. How do you guys
Mhm.
address that, or how do you work on that?
So that's, trial, depending on what it is, just hearing people's feedback. We all have, you could line up for different quadriplegics that have the exact same level of injury as I do, and we would likely do things differently. We all have our preferences, especially when it comes to tech. I mean, some people are very committed to something like a sip and puff mouse. This is just, generally for computer control, just because that's an easier one for me to explain. But some people use a mouse stick, which is just you put something in your mouth and you directly hit things like you would with a finger. But it's not a tech solution. It's kind of a just a tool. And some people use switches in their wheelchair where they can kind of move about the screen. And then for me, I like voice quite a bit. For me, that's just been what works, and I don't like to have a lot of, extra things in my face. But I think those kind of conversations are really, I hope, illuminating to folks that are designing future products, because it's important to hear those perspectives. You don't want to think that everyone wants, to use some kind of tool with their mouth, or that everyone wants to use their voice, because for some people that privacy implication is really huge. And I can say, I always say, okay, well, let's think about this. I don't only want to promote voice, because I think there's options to give people, different opportunities. So just really being thoughtful about that, but really learning about what's out there now, and what people, what they like about what they're using, and what they don't, what they're looking for. Um, we have tons of stories and insights in that, because, we're people who are relying on these tools all day long. It means a
Yeah.
lot to us.
Well, the end user, I mean, you guys there's no better thought leader than the end user of the tech. You guys know
Mhm.
what works and what doesn't work and that kind of thing. So are there areas of technology that are still needed for, that haven't been addressed as a whole?
I mean, yeah, there definitely are. There's things that were in conversations, about, or at least they're theoretically being discussed. But I'm really passionate about innovative wheelchair design, and
Mm,
making medical equipment smarter. Often we're kind of relegated into our wheelchairs being somewhat low tech. They're seen as, simply as a mobility aid, when technically they have such potential to be these, smart command centers that can help us greet the world. And really, there's a lot of implications with connected health there. Why can't our chair have features to actually do some remote health monitoring, or various smart features where we can connect, even if we're, out on the move. We shouldn't have to be tied to our computers if we're needing healthcare access or personal emergency response. We should be able to help. Um, we have to take these chairs everywhere. Why not make them powerful tools, instead of, just kind of something that moves you forward and backward.
yeah, and I think again is that's amazing, Brooke. And your comments there about using it and looking at the wheelchair as more a connected health device, I think is something I had not really thought of. But you're right, with the advent of sensors and wearables and all the other things, and cars that drive themselves, for goodness sake.
Exactly.
Where's Uber, right? On your council. Let's
Mhm.
get talking to them. How could we do better with the smart wheelchair technology? I love that.
Yeah.
Love that.
Yeah. Well, and even the connectivity. I mean, even in the healthcare care space, I mean, so much of that is dependent on transportation. I mean, we see this now, people not accessing healthcare because because of COVID, and limitations of actually getting into offices. But for us and folks in wheelchairs, just getting to the office at any time, if you don't have, proper transportation, you're limited. You're going to have a lot of trouble. And one of our Tech Access Group members is actually in Chicago, and she was mentioning, she lives downtown and she works from home and all of that. Or actually, I don't think she normally works from home. I think she is able to roll. She lives very close to our office, but right now she's working from home. But if she needs to go to a physician's appointment, she needs to leave work. She needs to take 3 buses, and then, and unfortunately, we're in the doctor's space more often, than your average person generally. Um, and so that takes a big part of her day. She's like, I often just have to take the afternoon off. I don't know when I'm going to get back. And then now she was just so delighted, because, you could just hop on a Zoom call, and it, takes a half an hour, and she doesn't have to interrupt her day, or, plan for the commute to the doctor's office.
Yeah, and you're no longer living for those healthcare appointments. Instead, they're just become
Yeah.
part of your life. There's just a piece of it, not the whole thing. You don't spend a whole day getting to and from an appointment. It's a great point, Brooke.
Yeah, yeah, because that can be weight, be weighty. For me, it's just, oh, okay, the rest of my day will be spent in the medical setting, and I have other stuff to do. So
Yeah, 100%. Yeah. So, Brooke, one of the things I love about this podcast is I get to sit down with amazing women leaders, and you are no exception. So, I thank you for your time today. But I would love to just then kind of switch gears a little bit, if you're okay with that, and talk about being a woman and being a leader, and being a leader in the space, and really what that has meant to you and what you've learned from that journey.
my very favorite part of my job is connecting people. And so as a woman, I try to keep that perspective. This is tech. Um, I'm relatively new to tech, and I'm excited to get to be doing this as a woman and carrying that forward. But I also want to bring more ladies in, so I'm constantly, trying to find, insightful voices from women in our communities to be heard. They have such unique perspective, and often. In our community, it's there's lots of men. Spinal cord injuries are just more prevalent in men overall, and just often women are still, they're mothers and they're doing, their wives and leading their families, and we don't hear from them as much as with anyone else. They're busy, and you know, life in a wheelchair and with a spinal cord injury is its own piece of the pie. So I really want to bring those voices out that we're just not hearing from as much, and make sure these women know that they're valuable customers and insights and experts, and make sure their perspectives are being heard. Because I'm really excited that mine, I'm getting this time to speak and and share my experience, which is something, I really have wanted for a long time, but really didn't know how to do. So
Well, I
I really,
imagine, yeah, there's many women who will benefit from hearing your story, Brooke, and from hearing your voice. When, to your point, the voices are more manly on most meetings about tech, et cetera. I would imagine there's a lot of women that have had not the same story as yours, but similar stories where, to see you in a position of leadership has to be an amazing thing.
yeah, it's been so nice. Yeah, just as people with disabilities, we often do feel invisible or just unheard, and so it's really nice that people have just kind of fostered opening this up, and there's a lot of women players in our Tech Access Council and group, and I love it. We're doing cool stuff. So yeah, I
That's
encourage any women that are listening, like know that there's a space for you.
I love that, Brooke. Well, one last question I always end every interview with. So I'm passionate about when life is busy, which as women, life is always busy. We all have to find a little room to breathe, as I call it, wherever that is, whatever that looks like for you. Where do you find when life gets busy, whether it just be in the middle of the day or whether it be a busy month for you? What does room to breathe look like for you? Where do you find that?
Mm, oh, that's good. It's a harder one this year, but it's being outside. I just need fresh air, sunshine. Um, yeah, that can really, right my I don't center me and just make me feel more at peace. Taking some time away from the screens. They're great and there's so much there and opportunity, but just kind of looking away and enjoying the sunshine. So yeah, it's sunny here in Portland today, so I am excited to get out there and take a little time.
Just awesome. Well, Brooke, it has been an absolute delight. I have learned a lot. I thank you for sharing your time today with our listeners. And on that said, I want to thank you for joining us and helping to amplify the voice of all those living with spinal cord injuries and disorders. For more information on the important work of the United Spinal Association, as well as how to get involved, you can go ahead and visit unitedspinal.org. And we'll be sure to include some of Brooke's contact information as well for those that want to reach out, either for the female mentorship piece or even getting involved with the Tech Access Council and user group. So as a reminder to our listeners, we drop new podcast episodes each week, and we hope you will join us. And until then, we just ask you to keep on accelerating. Thanks, Brooke. Thanks, everybody.